So welcome everyone, we are now starting the session. In chapter 1 we will discuss about the growth, and in this video we will just discuss about the normal growth of the child. So question number 1 is, a mother is saying that her daughter has increased only 3 kg weight in from 1 year to 2 year. She is asking, is it normal or abnormal? Means the question is saying that from the child from 1 year to 2 year the weight has increased only 3 kg. So is it normal or abnormal? So for that you will have to know about the weight pattern in the children. At birth the weight is around 2.8 or 3 kg. In 5 months the weight becomes double. In 1 year the weight triples, and in 2 years the weight quadruples, and in 3 years the weight becomes 5 times. So in this question, in 1 year the baby weight will increase 3 times, so it would become 12 kg, and in 2 years the baby weight will increase 4 times, so it will become 4 3s are 12 kg, and in 1 year the baby's weight will be 9 kg. So the difference is 3 kg, which is normal. So from 1 year to 2 year the weight will increase only 3 kg, it is normal. So there are some formulas. In 3 months to 12 months, if we want to calculate the weight of the baby, for example, if a child comes and his age is like 2 years or 6 months, so how I will know what is the normal weight, what is the abnormal weight? So in 6 months, there are some formulas to calculate it. In 3 months to 12 months, age in months plus 9 by 2 is a formula. From 1 year to 6 year, age in years into 2 plus 8 is a formula, and from 7 years to 12 years, age in years into 7 minus 5 divided by 2 is the formula. So by putting in the equation, you will get the normal weight of the child. These are roughly equal and will help in your clinical practice. So question number 2 is, a 4-year-old boy is 3 feet 3 inch tall. What is your diagnosis? Is it normal or is it abnormal? In 4 years old boy, his height is 3 feet 3 inches. So it is approximately 99 or 100 centimeters. So a 4-year-old child having 100 centimeter height is normal or abnormal? So for that you will have to know what is the normal height. So what is length versus height? Length is up till 2 years and height is after 2 years. Length is measured by infantometer and height is measured by the stadiometer. There are 2 photographs of an infantometer and stadiometer. Infantometer is on the left and the stadiometer is on the right. So moving on, at birth the length is 50 centimeter. In 1 year the length increased by 25 centimeter, so it becomes 75 centimeter. In 2 years it is 87.5. So how to remember this? It can be remembered very easily. It can be remembered very easily that in 1 year it is increasing 25 centimeter. In the next 1 to 2 year, it is increasing 12.5 centimeter. In the next 3 years, it is increasing 6.25 centimeter. In the next, it is increasing 6.25 centimeter. So you have to just make the equation half, like 25, then half is 12.5, then half is 6.25, and then 3 years to 4 years is again 6.25. So the question number 1 is, at 4 years it is double, and at 12 years it is triple. From 50 it becomes 100, and then it becomes 150. So moving on, there is another formula for calculating the height. For 2 years to 12 years children, the height is 6x plus 77. So just put the age of the child, like if the age of the child is, for example, 2 years, so it would be 6 into 2 plus 77, so 12 plus 77. Okay, it would be around 89 centimeter. Okay, so moving on, there are important points in the height. First point is height velocity spurt. Height velocity spurt is very important. How do you know that when will the height velocity spurt will come? Like many mothers come to us, the children, their son or their daughter, their height is not increasing, and what to do? We are trying, we are doing everything. So you must know that the height velocity spurt means that the height will start increasing in girls at around 12 years and boys at around 14 years. This is when the puberty strikes. Then the girl's height will increase from 12 years of age and boys from 14 years of age. And the another question is that we can also predict the adult height of the child in like 2 or 2.5 years. A boy's height at 2.5 years and at a girl's height at 2 years is exactly the half of their adult life. So if you have a child at home and who is around 2 years or 2.5 years, just measure his height, and then you can tell her mother that that lady that this boy's or this girl height will be around the double of the height which is present. So you can predict the height of the child. Now third point in this growth chapter is upper segment by lower segment ratio. So what is upper segment, what is lower segment? You must see this diagram. I have made a very bad diagram. In upper segment, the upper segment is from the vertex to the pubic symphysis, from the vertex to the pubic symphysis. This is the vertex and this is the pubic symphysis. So just measure by take a inch tape and just measure the length from height from the vertex to the pubic symphysis, and then ask the child to sit down. When the child will sit on the stool, just measure the length from the pubic symphysis to the heels of the child, to the heel of the child, and then you will get your upper segment. This would be the upper segment and this would be the lower segment. Just divide the upper segment divided by lower segment and you will get a upper segment by lower segment ratio. So in newborn it is 1.7 to 1.9:1. At 3 years it is 1.3:1, and at 7 years it is 1:1. You have to just learn it up. Why it is important? You have to as we are going increasing in the increasing in the age, you can see that the legs are increasing in length, because upper segment is first at birth was 1.9:1. At 3 years it is 1.3:1, and at 7 years it is 1:1. Why it is important? Why we are taking this into account? Because when we will learn stature, short stature, long stature, then it would be very important to know the upper segment by lower segment ratio to clinch the diagnosis of the child. So next heading is head circumference. Head circumference is very important. When I was posted in NICU and when I was posted in neonatal unit, we used to measure the head circumference on daily basis, because it gives an idea about many things, like the growth of the child, the brain development of the child, whether the child is having microcephaly or microcephaly, or whether the child is having any other abnormality. For that, if there was any problem in head circumference, then we have to do some investigations to see, like the USG brain or many other investigation to know what is the abnormality. So first point is how to measure the upper segment, how to measure the head circumference. So in this photo you can see that this is the occipital protuberance and this is the supraoptic ridge. From occipital protuberance to the supraoptic ridge, the doctor is measuring the head circumference, and in this you can see the child head circumference is 29 centimeter. So you must know what is a normal head circumference. At birth it is 33 to 35 centimeter. In first 3 months of life, the head circumference increased by 2 centimeter per month. Like I can say that at birth the head circumference was 33 centimeter. What would be the head circumference at 3 months? So you have to just add 6 into 33, because in first month it would increase 2, in second month it would increase 2, and in third month it would increase 2. So it is 6, and 33 plus 6 is 39 centimeters. So you can calculate. It is very easy. First 3 months it is 2 centimeter increase per month. In next 3 months it is 1 centimeter increase per month. In next 6 months is 0.5 centimeter per month. So for example, in this question, baby is 1 year old. Baby is 1 year old. You want to know the head circumference. Baby is 1 year old. What is the head circumference? So you can just calculate like 33 plus 6 plus 3 plus 3. So it would come out to be 33 plus 12. 33 plus 12 is 45 centimeter. And now they are saying that at from 1 to 3 years, the head circumference will be 0.2 centimeter per month increase. Okay. 2.2 centimeter per month increase, and you have to learn this at 12 month it is 52 centimeter. At 12 years it is 52 centimeter. This was a PGI question. At 12 years, what is the head circumference? It is a 52 centimeter. In next slide I have posted a question. Sorry, the train comes here again and again and it would disturb the video for just 15 seconds. Just bear with me. I am very sorry for the train interruption, and just bear with me, and sorry. So in this question you are saying that what is the head circumference at 2 years? So it is very easy. 33 plus 6 plus 3 plus 3 plus 2.4. So it becomes 47.4 centimeter. How did I calculate it? I calculated because this whole equation is for 1 year, and for the next year it is 0.2 centimeter per month. It is 12 into 0.4. Okay. Now the next question is that by 2 years of age, adult's brain size, child brain size is 83%. Okay, by 2 years of age, the child's brain size is 83%, and by 3 years of age the child head size is 90%. These are 2 MCQ. Okay, so most of the brain growth occurs in the first, second or first 3 years. At 2 years of age, 83% is of the adult brain size is the size of the child brain, and by 3 years of age the child's brain size is 90 centimeter. Now the next topic is chest circumference. You can see this lady is measuring the chest circumference, and she is measuring at the level of the nipples, the fourth intercostal space. So now we are moving on with chest circumference. At birth, head circumference is more than chest circumference, and but the difference is less than 3. Why we are saying that the difference is less than 3? Because many children who are born have macrocephaly or hydrocephalus. So you must know that if the head circumference is more than 3 from the chest circumference, then you must be getting an idea that okay, this is abnormal, the child is having more head circumference. And you know the normal head circumference also, that at birth it is 33 to 35 centimeter. At 9 months the chest circumference equals to the head circumference. By 9 years the chest circumference is equal to the head circumference, and by 1 year of age, the chest circumference overcomes the head circumference. So why it is important? It is important because this will help to know whether the child is growing or not. Now the next parameter, which is very important, which is also included in the criteria of the severe acute malnutrition, is mid upper arm circumference. So mid upper arm circumference, how it is measured? Mid upper arm circumference is measured by measured mid arm by overlapping technique. You can see that the child's in the middle arm, she is measuring the mid upper arm circumference. You must know the values of mid upper arm circumference. These are the mid upper arm circumference value. This is a Shakir's tape. This tape is called Shakir's tape. So you can see that there are 3 zones: red, yellow and green zone. The red is 0 to 1.5 centimeter, yellow is 11.5 to 12.5 centimeter, and green is more than 12.5 centimeter. You can only remember the yellow value, and then you will know what is the red and what is the green. 11.5 and 12.5 centimeter is yellow, and it denotes moderate acute malnutrition. And if the value is less than 11.5, then the child is severely acute malnutrition, means the child is in severe malnutrition. Okay, now the next heading in this topic is dentation. Dentation is very interesting topic, because many children come and by just asking them to smile, you can tell what is the age of the child. So it is quite fascinating to, if you know the dentation, you can just ask the child to smile and you can know what is the age of the child. So so dentation, in this dentation there are 3 things: temporary, mixed and permanent. So you just remember like this: if a child is born and then after some time some teeth starts erupting, like when a child's needs is started on complementary foods, after 6 months the child will need some teeth, and then the teeth starts erupting from the 6 months, and then after some time all the teeth gets erupted, and these teeth are called temporary teeth. And for some time there will be temporary teeth, and then some teeth will start falling, and then permanent teeth will come. For some time it would be mixed type of eruption, and after some time all the temporary teeth will fall down, and the child will have all the permanent teeth. So moving on, we are going first with the temporary teeth. Temporary teeth is till 6 to 7 years of age. So there are total 20 temporary teeth, and the formula is 2102. The formula is 2102. 2 is incisor, 1 is canine, 0 is premolar, and 2 is molar. So you know that there are no premolars in temporary teeth. Okay, and the formula for eruption is I am CM, I am Chief Minister. And you can just say that first the incisors will erupt. The incisors, the lower central incisor, then upper central incisor, then lateral central incisor, and then the lower central incisor, lower lateral central incisor. Okay, like lower central, upper lateral, and lower lateral incisors. So first these 4 incisors will erupt, and the order will be like 6 months, 7 months, 8 months and 9 months. Then the molar will erupt, and molar will erupt at 12 months, and then the canine will erupt, canine will erupt at 18 months, and then the second molar will erupt, and second molar will erupt at 2 years or 2.5 years. So this is a very good photo, and by this photo you can just see that these are the central incisor, this is the lateral incisor, this is the canine, this is the first molar, and this is the second molar. And order of eruption, first is the central incisor, then is the lateral incisor, then is the first molar, and then is the canine, and then is the second molar. I am Chief Minister. Now moving on, after 6 to 7 years, when all the temporary teeth have been erupted, temporary teeth starts falling down and permanent teeth starts appearing, and mixed dentition is till 12 years. So you can remember 6 year and 12 years. 6 years is primary dentition and 12 years is till 12 years is mixed dentition. In mixed dentition there are total 24 teeth, and there's some MCQ where it has been asked that calculate the total number of permanent teeth in mixed dentition. So the formula is very easy: age minus 5 into 4. Age minus 5 into 4. 4 is for all the quadrants is 4, and age minus 5 into 4. So next is permanent teeth. Permanent teeth, the formula is very easy. Firstly, you must know what are permanent teeth. Permanent teeth are of two types: successional or superadded. So successional or superadded teeth are like, it is like some teeth are successional and some teeth are superadded. So what are the, you just have to remember one thing, that the superadded teeth are the molars. These are the molars. Okay, the superadded teeth are the molars. This is the MCQ. Okay, and then what is the order of eruption? So order of eruption is mummy is in mnemonic is mummy is in bed, baby cries, milk. Mummy is in bed, baby cries, milk. So M is molar at 6 year, then incisor at 7 year, then incisor at 8 years, then bicuspid premolar at 9 year, then bicuspid premolar at 10 years, canine 11 year, molar at 12 years, and third molar wisdom tooth at 18 to 25 years. Okay, 18 to 25 years. The formula is very simple and very fascinating. Mummy is in bed, baby cries, milk. Molar, incisor, bicuspid premolar, canine, molar, and wisdom teeth. So this is the formula for permanent dentation. 2 1 2 3. 2 1 2 3. What is 2? 2 1 2 3. 3 is molar, 2 is premolar, 1 is canine, and 2 is incisor. Oh no. After 12 years, all permanent teeth will erupt. After 12 years, all permanent teeth will erupt. Okay. Now we are seeing delayed dentation. What is delayed dentation? Delayed dentation is no temporary teeth erupts by age of 13 months. So we know that the temporary teeth starts erupting at the age of 6 months. So if there is no temporary teeth eruption and the child age is more than 13 months, then there is delayed dentation. And what is natal teeth? Natal teeth means that the child is at birth only that the child is having teeth. What are the causes? Causes is SEEP. The mnemonic is SEEP. SEEP. So Soto syndrome, Ellis-Van Crevland syndrome, epidermolysis bullosa, and Pierre-Robin syndrome. Don't just get disturbed or irritated by these names, because when we will study them, you will become very habitual with these names. When we'll study Soto syndrome in another chapter or Pierre-Robin syndrome in another chapter, you will remember this. Just remember that natal teeth are present in Soto's, Ellis-Van Crevland syndrome, epidermolysis bullosa, and Pierre-Robin syndrome. Now the causes of delayed dentation. We are at cause of delayed dentation. Causes of delayed dentation are fried chicken prawn. The mnemonic is fried chicken prawn. So what is fried? Fried is familial, rickets, idiopathic, endocrine. In endocrine there is hypothyroidism, hypoparathyroidism, hypopituitarism, Down syndrome, cleidocranial dysplasia, and progeria. Okay, so they ask many times what is the most common cause of delayed dentation. The answer is idiopathic. Dentation is an important topic because many in our society, Indian society, many people tend to relate dentation with many malpractices, where many patients do home remedies so that the child's teeth get erupted. You have to just tell them that you have to wait till 13 months till we say that it is delayed dentation. Now the another topic is supernumerary teeth. In this photo you can see that this is a supernumerary teeth. What is supernumerary teeth? Supernumerary teeth is extra teeth. Most common location is between the maxillary incisors. This is the maxilla, these are the incisors, and in between the incisors this is the supernumerary teeth. Okay, and what are the cases in which it is seen? It is seen in cleft lip, cleft palate, cleidocranial dysplasia, and Gardner syndrome. So moving on, now we are moving on the topic bone. In the topic bone, first topic is anterior fontanelle. So anterior fontanelle, you can see this is a diamond shaped anterior fontanelle. The size is normal sizes, 2 into 2 centimeter. So anterior fontanelle, it is called the window of the bone. Why it is called window of the bone? Because when we were in NICU and we have to know that by clinically only, that we have to know that there's a raised intracranial pressure. We can just see the anterior fontanelle and we can just palpate like this, जैसे आशीर्वाद देते हैं ऐसे हम देख सकते हैं, और then we can know that whether it is going up or it is depressed, and by just seeing that we can know that there is raised intracranial pressure or not, or any other problem is there. And anterior fontanelle, it is formed by the fusion of the frontal bone here and then the parietal bone here. Okay, and this would be here the anterior fontanelle. And when will it close? It closes around 18 months of age, and it can close at as early as 9 months of age. Many grandmothers come with their child and they say that we are putting lots of oil over the anterior fontanelle to get it closed soon. So we ask, why you want to close the anterior fontanelle soon? They have no answers for it. So it does not close by putting any oil or anything else. It closes by itself, and the normal age of closure is by 18 months. And next is bone age estimation. See, you before reading anything, you must know what is the significance, why we are reading this, why it is important. So when you will see any patient of short stature and you want to know whether what is the cause of this child's short stature, it is very important to know his bone age, because then we would have a clinch in the diagnosis. So bone age is by doing the x-rays of various body parts of the various joints, and then using the Grulish Pile Atlas or Tanner Whitehouse method to estimate the bone age. These are just the methods by which we can calculate the bone age. So you must know at what age which x-ray is done. So at birth, knee joint x-ray is done, and at less than 1 year, shoulder joint x-ray is done. From 1 year to 13 years, wrist joint x-ray is done. 13 to 14 years, elbow and hip joint is done, and more than 16 years, we see the distal radial ulnar joint fusion. So you must be thinking how to learn this. It is very difficult. So I must say that it is very easy. You just know that from 1 year to 13 years, we just do the wrist x-ray. Okay. Before less than 1 year, we do the shoulder joint x-ray, and at birth we do the knee joint x-ray, because the first ossification center to appear is the calcaneum and the lower end of the femur, which is the knee joint. That's why at birth we do the knee joint, and till 1 year we do the shoulder joint, and till 1 year 13 year we do the wrist joint. Okay, so this is a way to remember this. Just draw a line from the elbow joint, and this is the hip joint, and this line will tell you that okay, these two joints we are doing from 13 to 14 years. Rest I have told you, it is very easy, that at birth we do the knee joint, and at till less than 1 year we do the shoulder joint, and till 1 year to 13 years we do the wrist joint. So these are some MCQs which are commonly asked. Earliest ossification center to appear, and I told you before, calcaneus or distal femur. And the first carpal bone to appear, it is a capitate. Number of ossification centers seen of carpal bones, it is age in years plus 1. This is a formula. Like a question will come that a child's age is 1 year, and you want to know how many ossification centers or how many carpal bone will be visible on X-ray. So just the formula is age plus 1. So age is 1, 1 plus 1 is 2. So this is the answer. So this is a mnemonic to remember the order of appearance of ossification center. It is very easy. These are the carpal bone. She looks too pretty, try to catch her. Okay, so scaphoid, lunate, and I don't know, remember the name, I just forgotten. Pisiform, trapezoid, trapezoid, capitate, hamate. Okay, I remembered the name. Thank you. So scaphoid, lunate, triquintral, pisiform, trapezoid, trapezium, capitate, hamate. Okay, so it is very easy to remember. Just take the capitate. Capitate appears at 3 months. Then start going in anti-clockwise direction. First go to triquintral, then lunate, then scaphoid, then trapezoid, then trapezium. Okay, so by this you will know when the ossification center appear. It is 3 months, 6 months, 3 years, 4 years, 5 years, 5 years, 5 years, 12 years. Okay, and distal radius appears at 1 year and distal ulna appears at 5 to 6 years. Next topic is puberty. Puberty is quite easy and very easy topic. Puberty, first we must know what is puberty. Puberty is the transition period from childhood to adulthood. It is called puberty, and in puberty we have all passed through it. Puberty is adolescent, and adolescent, the age group is 10 to 19 years. Early adolescent is 10 to 13 years, mid is 14 to 16 years, and late is 17 to 19 years. Now the sequence of change. This is very easy and many times it is asked in the exam. In girls it is Thilarche, pubarche, growth spurt, and menarche. Thilarche is the endocrine changes which happens in the breast, and the breast get developed. Then pubarche is the pubic hair growth, and then there's a growth spurt, and then after that there's menarche. Okay, menses. And in boys it is testicular enlargement, then penile enlargement, then pubic hair enlargement, then growth spurt, then axillary hair growth, and facial hair growth. It is just going from down to the above. Okay. Now in growth spurt, now in girls, the growth spurt appears at stage 3 and Tanner stage 3, and in boys the growth spurt appears at Tanner stage 4. We will just in the next slide we'll do what is the Tanner staging. So just remember that in growth spurt, the growth spurt means the child starts increasing its height. I had told you that in girls it is at around 12 years and in boys at around 14 years. So you have to apply it here only, that it is stage 3 in girls and boys it is stage 4. So what is Tanner staging? Tanner staging, many people try to mug it up, many people try to just mug it up and then forget everything. When you see 10-15 children and just do staging of just 10 children only, you will get a hang of Tanner staging, and it is very easy. In stage 1 it is childhood stage, just it is like childhood. You have to just remember stage 1 is childhood and stage 5 is adulthood. Now we have left with 2, 3, 4 stage. In 2, 3, 4, pubic hair growth is similar in both girls and boys. It is very much similar. The stage 2, the hair will be sparse, straight, and light and countable. There will be sparse, straight, light, and countable. You can just count the number of hairs on the pubic area. And in stage 3, the hairs will become curled, darker, and uncountable. You cannot count. And in stage 4, the hairs will be like adulthood distribution, but it would spare the thigh. And in stage 5 it would be like adulthood. Okay, so these are the hair pattern. And in breast development, you just remember, it is very easy that in stage 2 the breast start developing. In stage 3 the breast and the areola both starts growing. Okay, but they are not separate, we cannot see it separately. And in stage 4, breast will be areola and papilla will form a second mold over the breast. Okay, understood. And for Tanner staging in boys, the pubic hair is like the similar only. And in testes Testes, it is like first in stage 2 there will be growth of the scrotum and the testicular volume will increase, and in stage 3 the penile enlargement will occur. In stage 4 the glans penis will start enlarging, and stage 5 will be like adult. So this is the very favorite MCQ of many JIPMER examiner, that what are the volume of testicular volume. So it is very easy, and you can remember like this, that you have to just double. At stage 1 it is less than 3 cc, at stage 2 it is 2 2s are 4 cc, at stage 3 it is 3 3s are 9 cc, at stage 4 it is the 4 4s are 16 cc, and at stage 5 it is more than 25 cc. And this is an orchidometer. You can see there that there is 1 2 3 4 5 6, these are the different types of balls attached in the orchidometer, and just you have to compare it and know the testicular volume. So this is a question which is asked many times, which is the first visible signs of puberty. The first visible sign of puberty in girl, it is thilarche, and in boys it is testicular enlargement. They ask many times the age. So the thilarche starts appearing at 8 to 10 years, and the testicular enlargement starts appearing in 9 to 10 years. So you know that adolescence starts from 10 years. So just before adolescence, like from 8 years or 9 years onwards, these things starts appearing. And now we are just coming to the end of the chapter. So we have completed the normal growth. In normal growth, now we are just coming at the end. This is a summary. The ovum is from 0 to 2 weeks. The embryo is from 3 to 8 weeks. Fetus is from 9 weeks to birth. And prenatal period is 22 weeks to 7 days. Neonatal period is 28 days. Infant is 1 year. Toddler is 1 to 3 years. Preschool is 3 to 6 years. So how to remember the first 3 things? Just make E and then make mirror image of it, and then make a line like this, and you will get 3 to 8. So embryo is 3 to 8, and then fetus is 9 to birth, and ovum is for 14 days. Okay. Now you must be thinking that which hormone affects the growth in the fetal period. It is the insulin hormone which is present, which cause fetal growth. Insulin and insulin like growth factor. They will give you a question like insulin, thyroid, growth hormone, etc. You have to mark answer insulin and insulin like growth factor. Now these are the growth curves: height, head circumference, height, lymphoid, and gonads. So head circumference, I told you that maximum growth occurs till 3 years, which is 90%. And then height first it starts increasing till 1 year, and then at the puberty. Okay. Then lymphoid tissue 4 to 8 years, and gonads at puberty. So once a question came that maximum height velocity is seen at what time. So don't answer it at puberty, because maximum height velocity is in 1 year, because from 50 it becomes 75 centimeter. So it increases it is 25 centimeter per year. It is maximum. Okay. And next, the last slide is growth versus development. Growth. So you must know what is the difference between growth and development. It is very basic, that growth is increase in size and mass, and whereas development is maturation of the function. Growth and development both are cephalocaudal, from above to downwards. Okay. But another dimension is growth is distal to proximal. It is from distal to proximal. Like first the arms will grow, then the forearm will grow. Okay. The growth is distal to proximal, whereas the development is proximal to distal. Development is proximal to distal. So first the child will learn how to use his palm, and then the child will know how to grasp like this. First the child will grasp like from his palm, then the child will use his finger for pincer grasping, or like that. Okay. So just remember, the growth is distal to proximal. The growth is distal to proximal, whereas the development is proximal to distal. So just remember one thing. You can remember like growth is DP, distal to proximal. Growth is DP, distal to proximal. Okay. Now we just have to finish it off. Like we must know what are the growth chart. We have to use growth chart on daily basis, because to know the whether the child is having normal growth or abnormal growth. So in less than 5 years or 5 years of age, we use WHO growth chart, and in more than 5 years of age, we use the Indian Academy of Pediatrics growth chart. Okay, you just have to know one thing, that in WHO growth chart there is mainly percentiles, and in IEP growth chart there is mainly standard deviation. Okay, and you must be thinking, what is percentile, what is standard deviation? So it is very easy. You can see from this chart. Okay, this can be seen, but I will show you another photo. Like see from this, this is a length for age chart for boys. Okay, so in this you can see there is a green line. In this there is a green line. Okay, this is a green line, and then there's a 2 yellow line. This is a yellow line, this is a yellow line, and then there's a red line. Okay, so what this suggests, like for example the child age is 1 year. Okay, I am saying 1 year, and at 1 age his length is 75 centimeter. So where is the child falling? The child is falling in green zone. So green is normal. If the child length will be falling like in yellow zone, it is like yellow to red zone. In between yellow and red zone there are, so I can show you what are the zones also. Like in between the 2 yellow lines there will be normal zone. Okay, and in between the yellow and red line there will be danger zone. This is danger, and then after the red line, this and this, now you are in danger. This is danger. Okay, this is danger. So you have to know, you have to see that your child stays in this green zone, then the child is safe. Okay, so this is very easy. Okay, now you have understood, this is very easy. What are these numbers? These are like percentile, 50th percentile, 15th percentile, 3 percentile, 85 percentile, 90% percentile. So the child has to stay in between the range of this percentile, 15 to 85, means he is in green zone, he is safe. Okay, and more than 97 and less than 3 are red zone. More than 97 and less than 3 are red zone, so there's danger. Okay, and now we have to see according to the standard deviation. So standard deviation between -1 to -2, it is normal. Between -2 to -3, that if the growth is, we are seeing height for age, it would be stunted, weight for age it would be underweight, and weight for height it would be wasted. And if it is more than -3 standard deviation, means the child is in severe acute malnutrition, and severe malnutrition, not acute, severe malnutrition, and then severe malnutrition, then we if we are seeing height for age, it would be severe stunting, weight for age, severely underweight, weight for height, severely wasted. Okay, you got a hang of it. Okay, it is quite easy. Okay, what I used to remember it was like USA. Like I used to remember it when I was not understanding it, like underweight U, stunted S, and wasted I took A from WA and then made it USA. So this was my mnemonic. You can make it yours. It is, sometimes we tend to forget it, so it is easy to, it was easy for me to remember. You can make yours. And now we are going into the last topic, which is the apps for growth monitoring. It is just for your general knowledge. In your Android, if you are using an Android phone, you can download AnthroCal app, and if you are using an iOS phone, you can download Pediatric Growth Chart app, and in this you can measure, in this you have to just put the age and weight and height of the child, and it will tell you everything about the growth parameters of the child, whether the child is normal, abnormal. Okay, so this finishes us with the first topic and the first video. I am very excited to make more videos. You can comment down that what went wrong, what was good about it. I hope you liked it. I hope you'll watch it and you'll watch more. And in the next video I will tell you what are the abnormal things in the growth of the child. So it is very interesting. First you learn what are the normal growth things, then in the next topic, next chapter, you will learn the what is the abnormal growth things. So thank you so much, thank you very much, and I was very happy. Okay, so please subscribe so that you'll know that when the next video is out. And thank you so much. Bye, and study well, and I wish you all the very best. Thank you.